Hey everyone, my name is Becky Simonson, Rebecca Simonson, and I'm a vice president at 1199. And I want to thank everybody for joining us today. It's really exciting to see that we have nearly 200 people already on this call, 1199 members, community allies, legislators, members of the press. So our program today will last about 30 minutes. And we'll be hearing from state healthcare workers on the front lines, as well as our community allies. And our speakers will be raising common good demands that 1199 has developed in partnership with community organizations. All of these demands are about expanding this healthcare services that our state needs right now more than ever to meet the extraordinary needs of this moment and to address the extreme inequalities of race, class, and gender that threaten the future of our state. So I'm keeping everybody on mute so we can hear the speakers. If you're a member of the press that wants to ask a question at the end of the program, just either raise your hand or type it into the chat, and then I'll call on you and you can ask your question. So now I'll pass it over to Rob Burrill, president of 1199.
Good afternoon, and thanks to all for joining us, members of the press, legislators, allies, and of course our members who, 6,000 of whom every day get up and despite the pandemic, despite the dangers of the coronavirus, every day get up and do God's work amongst children who are at risk, the mentally ill, folks who are attempting to put their lives together after substance abuse issues, and the developmentally disabled. You are the true heroes of the past year, and thank you for all of the work that you do. I'm going to keep my comments very short because really the most important thing is to hear directly from those members and allies. But what we're here to talk about today is the expansion of state healthcare services in sectors that really provide the safety net for some of the most vulnerable people in our state. We know that the pandemic in particular has created mental health crises, has created tremendous hardship for people across the state, that there are thousands of people that our members provide care for who have developmental disabilities. We take care of folks who are attempting to put their lives back together after being in our jail prisons, doing all of that work in an atmosphere that where we have been speaking about today is attempting to use the state's budgetary process to move towards a vision of justice. You all know that budget are moral documents there, and moving resources in the direction of those vital services is something that is an urgent need. We oftentimes hear that Connecticut's budget is under-resourced, but the truth is that our state is amongst the wealthiest in the country. The 17 billionaires in Connecticut are $3.6 billion wealthier than they were on March 1st of last year. So while 1199 members have been heroically taking care of the sick during the course of the pandemic, we have 22 members as of today. We heard about another fatality today where one of our members lost their lives taking care of people during the course of the pandemic. While we've been doing that vital work, many of our state's wealthiest people have been getting even wealthier. So if we are broke on purpose. We have choices that we can make if our legislature and if our governor leads in the direction of justice. There are urgent needs in terms of the populations that our members are going to speak to. And so I'm going to turn it over to go through the request for expanded services in DDS, in expanding respite care, in DMHAS, in expanding housing care and reentry programs and mobile crisis that will make a real difference in the lived experiences of so many around our state. We're going to start with Sandra Morton, who is an LCSW at Capital Region Mental Health.
Good afternoon, everyone. And Rob just introduced me, so I don't have to introduce myself. I work in mobile crisis as a trained clinician in the Hartford area, where we help people who are experiencing mental health emergencies. Mobile crisis services are a collaborative intervention providing the most effective strategy for responding to mental health emergencies, preventing suicides and overdose deaths, and reducing ER visits. We are the workers who provide the safety net for the most disadvantaged people with severe and prolonged mental illness, often complicated by substance abuse. In Hartford and across Connecticut, we disproportionately serve people of color. Over many years, and especially the last 10, however, chronic underfunding has cut our services to the bone, leaving huge gaps in coverage on nights and weekends. As a result, mental health emergencies are often handled by the police, not trained mental health professionals like us. We need to expand mobile crisis services now more than ever. The pandemic and the huge mental health crisis that it has created have exposed the cracks in our safety net, cracks that our members and our clients have known about for a very long time. At Capital Region, the number of calls we receive from the police has tripled since the start of the pandemic. That is why we, the members of 1199, are standing united with community organizations. Together, we are saying loud and clear, this state can and must do better. We have the resources to fund universal, comprehensive, mobile crisis services statewide. We are demanding this as a matter of justice for the people that have been left behind in our society. We are demanding this as a matter of racial justice because the majority of the individuals we serve in mobile crisis are Black and brown. It's not a coincidence that these cuts have been made to a service that primarily assists working class communities and communities of color in particular. This problem is systemic. Recently, my coworker responded to a 211 call from a woman experiencing an emergency. She had overdosed. My coworker knew the woman and her specific needs, so she was able to react quickly. If the woman had called later on during the night and got the answering machine, she would have died. It was only because my experienced coworker was on shift to take the call that a precious life was saved and not lost. We refuse to let the state slash the services that people need. This year, we must expand mobile crisis services. It's the difference between life and death. Thank you.
Thank you so much, Sandra. Also speaking to expanded mobile crisis services, we have Jamem Davis, who is the co-director of Bridgeport Generation Now.
There we go. I couldn't unmute myself. Hi, everyone. Hi. Thank you so much to the Bargaining for the Public Good Coalition, specifically Katie and Norma, for inviting Gen Now to be a part of this important work. I am the co-director of Bridgeport Generation Now in Bridgeport, along with Callie Heilman, who is also on the call. And like the speaker before me, we do see this issue as a racial and social justice issue. So I'll read our statement. When George Floyd was killed in Minneapolis by a Minneapolis police officer in May of last year, it sent a shockwave through our nation. After protests and political pressure, Connecticut responded with the Police Accountability Act, a necessary first step in fixing our current policing crisis. But policing is not a crisis unto itself. It is part and parcel of the larger American legacy of racism that has persisted in this nation since its founding. It is part of a structural system designed to control and keep Black people locked out of opportunity and literally in bondage. Black Lives Matter is a call for the liberation of Black folks, for the removal of structural, institutional, and economic violence that has thwarted our progress and the progress of the nation. Bridgeport Generation Now is committed to that liberation and see the people's recovery as a tool to make social and economic equity a reality. In 2019, our Public Safety and Police Accountability Committee looked at public safety through a public health lens and recommended that the city of Bridgeport focus funding on addressing the root causes of community violence, i.e. mental health. The People's Recovery will help our state, help cities like Bridgeport to reallocate money to healthcare services that meet the needs of this moment. Bridgeport currently has no structural mechanism in place for people needing mental health services when the police are called. With the People's Recovery, we can expand mental health services through programs like the mobile crisis teams implemented in Hartford and New York City, where health professionals such as nurses, social workers, and psychiatrists can provide mental health services primarily in people's homes, eliminating the need for police to respond to nonviolent calls. Through the People's Recovery, Connecticut can fund programs like the Mobile Crisis Team and other community-led programs if we have a fair tax system. Currently, the bottom 50% pay an effective tax rate that is 3 times what the top 1% pay. That is not a fair, just, or equitable system. It is a testament to the structural racism that plagues this country and our state. This moment in history is calling on those in power to act in the best interests of all of us, not just the rich. Thank you.
Thank you so much, ma'am. Thank you, ma'am. Next, also on Expanded Mobile Crisis Services, Shannon Perkins, who is the board president of the National Association of Social.
Good afternoon, everyone. And as Rob said, my name is Shannon Perkins, and I'm the board president for the Connecticut chapter of the National Association of Social Workers. As we represent social workers of all backgrounds and practices across the state, we are thankful to be included in this important work today. In the wake of this unprecedented moment in history, it's imperative that we expand critical healthcare programs to communities in need across the state. More specifically, we must expand DMHAS-run mobile crisis intervention services to 24 hours per day, 7 days per week availability. These services should be the default response for all acute mental health emergencies and must be dispatched directly through 911. Over the past year, as the pandemic and a national reckoning with systemic racism have revealed devastating gaps in access to proper care for marginalized communities, and particularly communities of color, we've seen significant increases in rates of depression, anxiety, suicidality, and intimate partner violence. DMHAS clinicians have a unique and unparalleled ability to de-escalate acute mental health emergencies. Not only can they provide immediate support for those who make 911 calls, they can connect these folks with appropriate short-term interventions and long-term treatment that they otherwise are unlikely to receive. 24/7 mobile crisis services would clearly increase quality of care and save lives, essential steps in creating a Connecticut that serves all its community members. Thank you.
And thank you, Shannon. Next, speaking to expanded reentry services, we have Andreamittel, who is a discharge planner at Osborne Correctional Institution in the Department of Corrections.
Good afternoon. My name is Andreamittel. I'm a discharge planner at Osborne Correction. I've worked for the Department of Corrections for 13 years. My job as a discharge planner is to help prepare inmates for the release from prison and acquire things that they need to succeed in rejoining our communities. Our demands to expand reentry service is a demand for racial justice. Statistics show the state disproportionately incarcerates people of color. The population we serve, including people of every color, but especially Black and Brown, often have very acute medical and mental health needs. This means that on a daily basis, I am constantly making sure inmates being released have active medical orders, appointments, insurance, etc. Over the last several years, we have been cut to the bone along with other critical medical and mental health services for the inmates. We can't simply restore these services. We must expand the reentry service that people need, especially now that more individuals are getting released due to the pandemic. We need more support for people when they leave prison. We need housing. We need employment. We need mental health support. We need medical care. Only with these community supports will individuals have a chance to succeed. I see firsthand now the absence of robust reentry services for the formerly incarcerated, reinforcing structural racism. Because of the huge barriers that communities of colors face in terms of employment, housing, healthcare, and education, people of color who are leaving prison are trying to re-enter their community, lack the services necessary to do so. Making the situation even worse, these people have a grapple with racial bias when it comes to policing and increasing their chances of recidivism for small nonviolent charges like smoking marijuana. The system in our society have failed people, especially people of color. The reward for this failure to send them to prison. Prison is what happens when people don't have their basic needs met. We need programs. We need the people to follow them. We need the people to encourage them and assist them so they can be successful.
Thank you, Andrea. Also speaking to expanded reentry services, James Banderi Alexander, who's the legal director of the Transitions Clinic Network.
Thank you. My name is James Banderi Alexander. I'm the legal director of the Transitions Clinic Network. The pandemic has shown us that we need to invest in the health of Connecticut residents. And if we want to have healthy communities, we need to invest specifically in the health of the most vulnerable individuals in the community. Huge numbers of people are leaving incarceration with chronic conditions, and they face barriers to engaging in primary care and managing chronic conditions after release. This leads to bad health outcomes. In the first 2 weeks following incarceration, people are 12 times more likely to die than a person in the general population. Transitions Clinic addresses those barriers by incorporating formerly incarcerated community healthcare workers into the traditional medical clinic. Community health workers provide culturally appropriate health education and information. They can reach community residents where they live, eat, play, and work and worship. Community healthcare workers are the frontline agents of healthcare change. We have empirical proof this works to lower rates of acute care, ER visits, to lower parole and probation violations, reduce incarceration days, and lower recidivism. But we need the state to step up and fund the hiring of formerly incarcerated community healthcare workers, and do it now. It's an investment in the health of all of our communities. And that's why I'm so glad that the Bargaining for the Common Good proposal includes the hiring of 50 formerly incarcerated community healthcare workers to work throughout the state, to join the 4, that's right, you heard me, we only have 4 right now working for the whole state. We need all 50. So thank you for listening to me today.
James, thank you. Next to speak to the crisis in addiction services, just a very disturbing fact is that since through October of last year, we've seen a 13% increase in drug overdose deaths compared to the previous year. We vitally need to improve addiction services. And Brian Williams, who's an addictions counselor at Connecticut Valley Hospital with DMHAS, is going to speak to that point.
Thanks, Rob. Good afternoon, everybody. Indeed, I am Brian Williams, and addictions counselor in one of the male rehab units at Connecticut Valley Hospital in Middletown. Our particular unit provides care for men who are mostly coming out of the Department of Corrections or are under some form of judicial supervision and are being offered treatment in lieu of incarceration. When we provide these services, we impact people's lives in ways that help them regain their health, re-engage with their families, secure employment, and even beyond. We are offering a real opportunity to overcome the answers to the questions posed by Langston Hughes in his poem, A Dream Deferred. He asks, what happens to a dream deferred? Programs like ours answer boldly that we offer a bridge away from deferral, a bridge that does not only allow for inspiration and hope, but reconnecting back to the communities from which our patients come, where they become a source of hope for those who are still struggling. One of the first patients I had when I started in 2012 was homeless, living on the streets, and was in and out of jail. One of his strengths that he came to us with was that he grew up in a strong faith tradition, but had separated from that. addiction was destroying him. He came to us and we stabilized him and we recommended a faith-based residential program for aftercare. This has led him to not only stay sober for the last 9 years, but also to reconnect with his faith and now works as a staff member at this program. For the last 9 years, he has been sober. He has reconnected. He has a job, or as he would say, he has a mission where he is able to bring his positive experience with addiction recovery and also the message of his faith to inform and touch the lives of others. What did the rehabilitation program at CVH do for this individual? It offered him a place to receive care in lieu of incarceration. It offered him education and stability, and also placed him in an environment for aftercare to continue on his recovery journey. What happens to those whose opportunities for treatment are deferred? Deferred because we do not have enough beds, deferred because programs are not adequately funded. What happens to those people? Part of what has occurred during the pandemic, as has been mentioned already by several previous speakers, is that the need for addictions treatment, the need for substance use disorder treatment, the need for mental health treatment has escalated. And what has happened at CVH is, in order to respond to the immediate crisis, to the medical crisis of the pandemic, we have had to decrease our capacity to provide addictions treatment so that we can meet the medical needs, so that we can deploy staff, so that we can deploy space that's used for addictions treatment to be used for providing medical care. Medical care is extremely important. A well body is extremely important. It is foolhardy, however, to pursue well body at the expense of emotion. I raised the image of a bridge at the beginning of this talk. And I just want to say this, I want to end with this. We are glad that this bridge is a two-way bridge. It's a bridge indeed that allows the people who come into us to do the work here, that allows them to move away from active addiction. It is a two-way bridge because every year in this place, we celebrate what we call, Alumni Night in September, which is National Recovery Month. And during this time, our patients, like the one I mentioned previously, come back. And they come back to bring this message of hope to the people who are in treatment. So why are we advocating for expanded services? We are doing so because, number one, it works. We're also doing it because there's a need for it. We also are doing this and asking that, reflecting what's been said previously, that is a disproportionate percentage of people of color are have been affected by the pandemic. And as we do this, we should do the funding in a way that impacts these communities and not just pay lip service.
Thank you so much, Brian. And we have one of the alumni that Brian just spoke of, Victor Rodriguez, who came through the Addiction Services program at Blue Hills Hospital.
Yes, can everyone hear me? Hello?
We can hear you.
Yeah, we can hear you, Victor.
Oh, okay, good, because I'm in a room here trying to hide. I'm gonna be quick. I just wanna let you know that it troubles me when we have floors, not just floors, beds all over the place at Connecticut Valley Hospital. And we're not filling them with addictions, mental health. Here's a city. I live in Hartford. I grew up in Hartford. A lot of crime. Addiction goes from leaving your family to stealing. When you need a fix, there's nothing. You start stealing. You go to jail. Come out of jail. Your family rejects you. You can't find jobs. There's legal issues. You got to attend court. All kinds of stuff. It just complicates. The reality is that drug addiction is a complex disease, and it takes more than just 7 days in treatment. And it takes time. What I want to do is let you know that I want to thank DMHAS and the politicians that understood this, that the disease concept of addiction is more serious than what people think. We could try quitting. It's a little bit more than that. It's more complex than people think. But I went to Blue Hills and got my life together, and it began in 1984. I've been clean ever since. I'm a staff for DMHAS. I'm the senior counselor in the state of Connecticut at this time. And that took places like Blue Hills being open when I needed it now, not wait, call next week, because the now turned to committing the crimes and trying to get more fixes and getting more jammed up. I'm not sure what's the problem with opening those beds and getting a lot of the victors out of these streets in Hartford. I'm all over Hartford, Connecticut, getting people into treatment center. I follow up, I call, and the beds are full that are open. So I'm asking to open these beds up, or people gonna, no beds, deaths. That's what you're gonna see. No beds, incarceration. No beds, crime. And then from generation to generation, kids I knew from back then are today addicted and dealing out in the street. This is a serious problem. Why aren't we opening these beds? We can do it in the state of Connecticut. Thank you so much.
And Victor, thanks for the amazing work that you perform every day in helping people put their lives back together. You are an inspiration in the work you do, and your coworkers are an inspiration. Next, we have Sarah Fox, who is going to speak to expanded housing and expansion of young adult services. Sarah is from
Hi, I'm Sarah Fox from the Connecticut Coalition to End Homelessness. Homelessness is not a personal failure. It is the result of system failures and is actually a matter of life and death. And we at the Coalition definitely recognize that. And we realize what so many of you have said, that it is a choice that our policymakers are making, and it must be ended now. The COVID-19 pandemic has underscored that this is a public health crisis for us all. And people of color disproportionately bear this burden. To ensure that we have equitable treatment and safety for those experiencing homelessness, we have to really have strong conversation with our policymakers. We have to ensure that we can protect our vital homelessness resources and grow the amount of money that is coming into our communities for housing and homeless services. And we have to ensure a right to housing for all, work closely with our policymakers on eliminating any bans, ending discrimination against renters based upon criminal records, and also forward our conversations on justice reinvestment and ensure that money comes back into the community for housing and case management services and for mobile crisis.
Sarah, thank you. We're moving next to Alicia Bailey, who is the parent of a child that receives DDS respite services. She's going to speak to the need for expanded respite services for our developmentally disabled families.
Good afternoon. My name is Alicia Bailey, and I live in Windsor, Connecticut. I have 2 disabled kids at home. One of my sons goes to the state-run DDS respite center in Windsor. These services have been so important to him and for me. He doesn't have any other kids that come around, and respite is a way for him to develop some social skills and be with other kids. Both my kids are full-time need care. They cannot do anything for themselves. This is my entire life, and I have no break other than respite. Even though I love my children and I would do anything for them, it is a mentally and physically draining life. Respite is a home away from home for my son. He loves going there, and the staff love him. They're like family. The staff are exceptional. He gets to go to lots of recreational activities that I am not able to take him. He go to the store, go bowling. The staff know him, and I trust them with his life. They are very caring and very loving to him. He look forward every time he hear that he has to go to respite. He is so excited. We must expand these important respite service. Right now, he only gets to go 2 to 4 times a year. It would be amazing for him to be once a month and with the option of 7 days at a time. These respite services are so important. We must expand them for our family. It's in great need.
Alicia, thank you so much. Next, we're moving to Ellen Whalen. Ellen is a psychologist in the Department of Children and Families. She's going to be speaking to expanded DCF services.
Good afternoon. I'm a supervising psychologist at DCF's Albert J. Solnit Children's Center, and I've been a state employee for over 13 years. My duties involve supervising clinicians as well as providing individual, family, and group therapy to the most vulnerable youth and families in the state who have frequently been the victims of horrific traumas and face stigma and bias related to mental health challenges, race, and socioeconomic status. Expanded services at DCF would entail prevention efforts so that children and families receiving services will not need intensive out-of-home treatment and will help keep families together, as well as supports throughout the various levels of care. Additionally, expanding treatment for substance abuse and intimate partner violence is greatly needed. Disparities related to child welfare involvement and out-of-home care are also needed to be addressed through continued innovative programming, resources, and education to address implicit bias. Working through the pandemic in a residential program where youth and families could not see each other for many months has not only been extremely heartbreaking, but also incredibly challenging, as our usual opportunities for youth to practice generalizing their skills learned in treatment in the community and in their homes with their families are no longer available. We know that suicide had been on the rise prior to the pandemic, and a recent CDC report confirmed the need for expanding services with children and adolescent anxiety, depression, and suicidality to have been exacerbated with the decrease in access to services, types of services, and decrease in supportive environments for our youth and families with the greatest needs. Substance abuse and intimate partner violence have also increased following isolation associated with the pandemic. Cutting services will only increase the hardships and challenges for those already struggling with isolation and economic impacts of the global pandemic, as well as stigma and bias related to socioeconomic status and the racism pandemic. Thank you for your time.
Thank you, Ellen. Last, we have Darnell Ford, who is a lead children's services worker in DCF.
Thank you, Rob. My name is Darnell Ford. I work at the Solnit Psychiatric Children's Center. I'm a lead children's service worker for the past 22 years. I work with kids who need support and services for their mental health at their most vulnerable point in their lives. And I just have to say, you know, there's a script here to read, and I will read it, but after hearing everything from what these speakers have said and where everyone is in their lives and what we're supposed to be doing, it's just even more disheartening that I see them as young as they are and know that this pipeline that has been created, that's where they're headed. And I'm here called as a hero. I'm called as an essential worker during the worst moments in people's lives. And I'm doing the best that I can. And I have to watch people struggle and beg and ask for services that they should already have. Once again, we're sitting here discussing and having a conversation about things that should be standard, things that we should be going above and beyond in the state of Connecticut for the people that we said we would support, people we said we would provide services for. Instead, as I'm called that hero and that essential worker, I'm told that at some point, the child that you're trying to help, the family that you're trying to support, we will be cutting those services at some point in their life, if not now. That this is the conversation that we need to have because we're too afraid. We're not willing to challenge. We're not willing to take that direct route. What we know we should be doing, the good fight, the right fight, which is to take this right to those people who can afford to be able to utilize the resources that are right now within Connecticut. We have these resources. We are one of the wealthiest states in this nation, and yet we still stand here having conversations about services that should already be provided. My nephew is going down that pipeline because those services are not, that pipeline is not being broken. So he will be on his way to jail just by the color of his skin. So it's very disheartening that we still are having these conversations, that we don't have the people out in front of this thing, that this is the priority. This is what we need to do now. And it's no longer time to have conversations, but to take action. This is our first and foremost action. This is a crisis that is within our state, that it has been, that has always fallen short of what it should be for the children and families in the state of Connecticut. I'll go into work tomorrow and I'll still stand strong as that essential worker as that person, as that hero, as that child looks up to me and asks me why, and I'll try and find all of those reasons and all of that necessary support to support him, her, and that family, as I did today, which is why I'm here now, because I left work to be able to let people know that I will have this conversation, but I guarantee you I will be champion for action from this point on. People need to stand beside me and the rest of my coworkers to say this is no longer just a conversation. We are to take this fight, this good fight, right to those who can make these decisions and bring these resources to the children and families in Connecticut now. Thank you, Rob.
Darnell, that's it's hard to follow. I mean, I think that what Darnell just spoke to is exactly what all of us know to be true. That we don't have one Connecticut, we have two. We've got Greenwich and Glastonbury and Simsbury, and most everybody in those communities has everything that they would ever need. They don't need for education, they don't need for housing, they don't need for mental health or substance abuse care. If somebody's unfortunate enough to come to a life crisis where they have an addiction or a mental health problem, or they're born developmentally disabled, people in those parts of the state that are some of the wealthiest areas on the planet know that their family resources are such that they're going to get the care and the love and the support that they need. What we are asking our legislators to do is to make a sacrifice, not from the majority of the people, but from the people who have enough to give, from the multimillionaires, from the billionaires in our state, who have been making money while our members have been taking care of the neediest people in Connecticut, the at-risk children, the mentally ill, the homeless, the substance abuse, the substance addicted, the developmentally disabled. During the course of the pandemic, our members have been getting sick. They've risked their lives. Some of them have lost their lives. Some of them have brought the virus home to their family. And so what we were asking for is to make an investment in the services that we have spoken to today, because ultimately it creates opportunity, it saves lives. The love that each of our members who have spoken today bring to their day-to-day work is not enough when there aren't the resources to meet the need, to meet the demand. So we want to thank the many legislators who joined us today. Representative Pat Dillon, Representative Jillian Gilchrist, Senator George Cabrera, Representative Ann Hughes, Representative Bobby Gibson, Senator Matt Lesser, Representative Kate Farrar, Representative Tammy Nucio, Senator Julie Kushner, and Senator Derek Slapp. And if there are any questions,